Hello and welcome. My name is NURUL SHAFIKA and I'm presenting to you today from Faculty of Health Science UKM. And today I want to share a little bit to you about the prevalence and distribution of high-risk and low-risk human papillomavirus infection in women with normal and abnormal cervical sample, a retrospective study in Malaysia. We are interested in doing this because human papillomavirus (HPV) accounted for 99% of all cervical cancer cases, making it the third most common type of cancer among Malaysian women. Persistence of high-risk HPV infection is a major contributor to the development of cervical cancer. Thus, determining the prevalence and distribution of HPV genotype in Malaysia is critical in identifying the pattern and disease association. This study was conducted to determine the frequency of cervical lesion status and the frequency of high-risk and low-risk HPV genotype in Malaysia. Next, to determine the relationship between cervical lesion status with high-risk and low-risk type of human papillomavirus. For the method, the detection of HPV genotype was tested on CGene Aniplex 2 HPV28, and this study was the first using this method in Malaysia. For the result, we saw this result for objective 1. The percentage of HPV positive women with normal cervical was 68.3% high compared to HPV positive women with cervical lesion. Most common cervical lesion detected with an HPV positive patient was ASCUS 12.9% and LCL 12.6%. The prevalence of high-risk HPV infection was 60.7% and low-risk HPV infection was 21.5%. Next, HPV 52, 14.6%, HPV 58, 10.1%, HPV 53, 9.4% were the most common high-risk HPV genotype, while HPV 42, 18.3%, HPV 54, 16.6%, and HPV 61, 14% were the most common low-risk HPV genotype. Cervical lesions were found to have significant difference in determining the possibility of an individual having high-risk or low-risk HPV infection. Some previous studies have shown that there is association between cervical lesion with HPV genotype infection. For the conclusion, according to this study, the most common high-risk HPV genotype in Malaysian women were HPV 52 and 58, while HPV 42 and HPV 54 were the most common type of low-risk HPV genotype. Cervical lesions have a significant correlation with HPV genotype. This finding may contribute useful information to healthcare providers and may assist in determining further treatment, vaccination program, or screening measure for patients in prevention of cervical cancer in Malaysia. That's my reference. And thank you.